She set the pillbox down on the kitchen table the way she had every morning for the last 11 years. 7 little compartments. 7 days. Routine. Comfort. Safety, or so it seemed. But on this particular morning, something was different. She'd just come home from the doctor with a new prescription, something for her blood pressure, and she'd slipped it into the box without a second thought, right next to a medication she'd been taking for years. What she didn't know, what no one had explained to her in the rush of a 15-minute appointment, was that these 2 medications together were about to send her blood pressure crashing. This is the quiet danger that threatens millions of older adults every single day. Not a dramatic accident. Not a visible wound. Just a small mistake, made with the best intentions, that the body cannot forgive so easily. As we age, our bodies change in ways most of us never see coming. The liver slows down. The kidneys don't filter quite as efficiently. Body fat increases while muscle mass declines, and that shift changes how medications move through the bloodstream, how long they linger, how strongly they hit. A dose that was perfectly safe at 50 can become risky at 75. The same pill, the same milligram count, can behave like an entirely different substance inside an aging body. Then there's the sheer number of medications. Many older adults manage 5, 8, sometimes more than 10 prescriptions at once, for the heart, the joints, the mind, the blood sugar. Each one prescribed with good reason. But rarely does anyone sit down and look at the whole picture, the way all these medications interact, overlap, and sometimes quietly work against each other. This is called polypharmacy, and it's one of the most under-recognized threats to health and independence in later life. It's not about any single doctor's mistake. It's about a system where information gets fragmented, one specialist for the heart, another for the bones, a third for the mind, and no one medication list is ever fully complete. Consider the woman with the pillbox. Her new blood pressure medication wasn't wrong. Her old one wasn't wrong either. But together, without adjustment, they multiplied each other's effects. Her blood pressure didn't just lower, it plummeted. She felt dizzy reaching for a coffee cup. She gripped the counter. She didn't fall, not that time. But the warning had arrived, quiet and unannounced, the way these things so often do. This is the story of medication errors in older adults, not a clinical footnote, but a daily, human reality. A reality made of love, of trust, of trying to follow doctors' orders exactly right, and still finding the ground shift beneath your feet. A reality where the very treatments meant to protect a life can, without anyone noticing, begin to put it at risk. What happened to her at the kitchen counter is happening, in some form, to someone's mother, father, or grandparent right now. And too often, when these incidents occur, they get written off. A fall gets blamed on just getting older. Confusion gets blamed on just dementia setting in. Fatigue gets blamed on just aging. But sometimes, more often than we'd like to admit, the real cause is sitting quietly in the medicine cabinet. Take falls. Every year, falls send millions of older adults to the emergency room, and a significant portion trace back to medications, sedatives that linger longer than expected, blood pressure drugs that drop pressure too far when standing up, or combinations that cause dizziness no one anticipated. A hip fracture from a fall can change the entire trajectory of someone's life. It can mean the difference between living independently and needing full-time care. And it can begin with something as small as one extra pill, or one medication taken at the wrong time of day. Then there's confusion, the kind that frightens families the most. An older adult who was sharp, witty, fully present, suddenly seems foggy, forgetful, disoriented. Family members panic, wondering if this is the beginning of dementia. Sometimes it is. But sometimes, it's a medication, an antihistamine, a sleep aid, certain pain medications, quietly clouding the mind in ways that mimic cognitive decline so closely that even trained eyes can be fooled. The frightening part is how reversible this often is. Stop the medication, under proper medical guidance, and sometimes that fog lifts. The person comes back. And it's not only about taking the wrong combination. It's about timing, taking a medication on an empty stomach when it needed food, cutting a pill in half when it was never meant to be split, forgetting a dose and then doubling up the next day to catch up, a decision made with good intentions that can flood the body with too much of a substance at once. Vision changes make pill bottles harder to read. Hearing changes make instructions easier to mishear. Memory changes make it harder to recall whether that morning dose was already taken. None of this is carelessness. None of this is failure. It is simply what happens when the body changes, the medication list grows, and the support meant to catch these gaps isn't always there in the moment it's needed most. And there's a particular kind of heartbreak in this. Because these aren't strangers making careless mistakes. These are people doing exactly what they were told, taking their medicine, trusting their doctors, trying to stay well. The system asks them to manage something that would challenge even a trained nurse, and then quietly expects perfection. When something goes wrong, the shame often falls on the person, when really, the failure belongs to a system that never gave them the full picture in the first place. You said, next. So what actually protects someone in this situation? It starts with something deceptively simple, one complete list. Every medication, every supplement, every over-the-counter pill, written down in one place, brought to every single appointment. It sounds almost too small to matter. But that one piece of paper has stopped countless dangerous combinations before they ever reached a bloodstream, because it forces every doctor, every pharmacist, every caregiver to see the whole picture instead of just their piece of it. Pharmacists, too, are an underused line of defense. They are trained specifically to catch interactions that a busy physician might miss in a rushed visit. Asking a pharmacist directly, "Is this safe with everything else I'm taking?" is not a burden, not an inconvenience. It is one of the most powerful questions an older adult or their family member can ask, and it costs nothing but a few minutes. There's also a quieter kind of vigilance that matters just as much, noticing the small changes. A little more dizziness than usual. A little more confusion in the evening. A bruise that appeared without an obvious bump. These aren't always just getting older. Sometimes they are the body's only way of saying that something in the medication routine needs a second look. Families who pay attention to these subtle shifts, who ask questions instead of assuming, often catch problems long before they become emergencies. And periodically, ideally once a year, every medication should be reviewed, not just renewed automatically, but truly reviewed. Is this still needed? Is the dose still right for this body, at this age, in this season of life? Medications that made sense a decade ago don't always make sense today, and a body that has changed deserves a treatment plan that changes with it. None of this is about fear. It's about awareness, the kind of awareness that turns a quiet danger into something visible, something manageable, something survivable. The woman at the kitchen counter, the one who gripped the edge of the table as the room tilted slightly beneath her, she didn't fall that day. And stories like hers don't have to end differently for anyone else, as long as someone is paying attention. Because behind every pill box, every prescription bottle, every 7-day routine, there is a person who deserves to be safe in the very treatment meant to help them. That safety doesn't come from luck. It comes from questions asked, lists kept, and small changes noticed before they become big ones. If this story made you think of someone you love, a parent, a grandparent, someone managing their own pill box every morning, don't keep this to yourself. Share it with them. Talk to them about their medications today, not someday. And if this reached you, if it mattered even a little, take a moment to like this video and drop a comment below. Tell us about someone you're going to check in with after watching this. That one comment might be the reminder someone else needed too.